Hey, hi, my name's Amanda Maxwell, and I am one of the pre-health professors, pre-health advisory committee members and a lecturer at UNC Asheville. And I'm going to spend this time giving y'all an overview of the pre-health professions, how it works at UNC Asheville, and look at the resources that are available to support you in your undergrad education, and also talk to you about some of the opportunities that we have to help y'all along the way. So this is our website. The address is prehealth.unca.edu. And when you go here, it's just, first page going to give you an overview of all of this. Now, the thing that is changing and more dynamic is the events and opportunities link, which, for example, this is one of the events and opportunities. And we'll look at that a little more in a second. So how do we do pre-health at UNC Asheville? Well, first, at other schools, some other schools will have a major that's pre-health. We don't do that here. It's a liberal arts university, and so you're going to get a good breadth of education, which is going to help prepare you for whatever you go into, including and especially, I think, the healthcare field. And within that degree, you have a certain number of hours you have to get for your major. So to graduate from UNC Asheville, you have to have 120 hours. And depending on your major, you may have as many as 50 or 55 hours of that 120 that is part of your major, especially if you're looking at a Bachelor of Science. Probably three of the most, probably the four most common, most popular degrees that we get, four at UNC Asheville, and I'm not saying you should get one of these degrees, first off, but the most popular are the biology, which is a Bachelor of Science, a chemistry, either a BA, Bachelor of Arts, or a Bachelor of Science. And both of those, they're similar. Bachelor of Science is going to have more hours. Another popular one is the Health Wellness Promotion, and that's a Bachelor of Science, and they have some different tracks. But all of the Bachelor of Science, again, are going to have 50-something hours. It just means you had a more in-depth educational experience. In some cases, like for chemistry, the Bachelor of Science means you'll be doing actually hands-on research, which can be advantageous for your mental development and also for your resume and application. Another degree that is fairly popular because people are just really interested in it is the Psychology BA, and that is a Bachelor of Arts, so it's less hours, but I would not choose a degree based on that. You should choose a degree that is based on what your interest is, what you enjoy doing, because you're going to be doing a lot of it. You need a backup plan. If you're interested in going into anything, you always need a backup plan. And if you're interested in going into medicine or healthcare, you need to have a backup plan, because what if you don't get in your first year? What if you change your mind? You don't want to study chemistry because you heard it was a good degree to get, but you really don't like chemistry. Or I had a student say, well, everyone's telling me I should get a physics degree because it's really rare to have medical students have physics degrees, and so that's a really good one to get. And they had never taken a physics class. I'm like, we need to get you in a physics class and see if you actually like it. That person's not a physics major. Not to say anything against physics, but you don't go off what people say. So what we do at UNC Asheville is we help support your planning of your classes so that you can get the classes you need for your chosen profession. And I may default today and say medicine a lot, but whatever it is, and I'll show you some comparisons of the classes that are needed for different professions. But say you're going to medical school and you're getting a biology degree, well, you're going to see that there is a chemistry class that is highly recommended that is not part of the biology major. And so figuring out how to just kind of fold that into your time here. And it's totally doable. You have 4 years or 5 years, to take these classes and get this done. Hi, welcome back. Cool, welcome. So just so again, just a summary, the overview of the pre-health professions. We don't have a degree here. We have degrees that have a lot of the courses that you want to take, but then we help fold in the prerequisite courses that you need throughout your educational experience. So why do I have this job? What is my, not that y'all are necessarily asking me to vet myself to you, but I actually graduated from UNC Asheville. And I personally got a chemistry degree. I'm on here somewhere, there I am. And I got a chemistry degree because my backup plan was to go environmental if I didn't get into healthcare. I was interested, I liked chemistry. It was challenging for me. It was certainly harder than other subjects, but I enjoyed that. And I still wanted to make the world healthier. And so if I couldn't do it for people directly, then I wanted to do it via the environment. That was my backup plan. And then I went to medical school. I went to Chapel Hill and graduated with an MD. And so I'm like more your traditional doctor than the PhDs, they're doctors too. But I don't practice, I teach instead, and I do advising. So I've been through the process, and I've been through the process here, and I know what worked for me and what was missing or what I wished I had. But we have, so I'm the coordinator, and I'm one of the pre-health professions advisors or on the advisory committee. And we have people from multiple different departments. And I'm just going to point them out real quick. Dean Holt, he is the Dean of Natural Science. He's our director. And he's actually an organic chemist. So when he's not a dean, he's teaching chemistry classes. Judy Beck is a physics professor. This says that I work in health and wellness promotion, and I am kind of a moving lecturer. So this semester I'm in chemistry, last semester I was in biology. So Ted Meigs is a cellular biologist. So he teaches in the biology department. Michael Nealon is in psychology. Jason Wingert is in health and wellness, and he is actually a physical therapist as well. So he has unique insight into that profession and things. So I mainly focus a lot of the advising I do on medical, dental, vet, and pharmacy, and with some PA support. But I'm here to help support you in whatever your interest is. And then our last person on the committee is Amanda Wolf, and she is another chemistry professor. So these people are all knowledgeable about pre-health here. They've been doing it for years. They've had a lot of students who've asked them lots of questions. So if you're ever worried about if you're going to look dumb or something, please don't, just ask. If there's only dumb questions when it's not asked. The goal is for you to learn more. All these people also have known a lot of students who did and didn't get in. So their advice is very valuable. Okay, so going back up to the top. What I, again, am doing is using their website to help you navigate through the information that I'm trying to just share with you. I think that one of the best things about UNC Asheville is that it's very collaborative. Like, we want to work together. I want students to work together. There is no reason that students shouldn't share any information, because medical schools or dental schools or pharmacy schools, they don't have any sort of quota. We can only take this number of people from UNCA. If they like everybody who applies, they're going to accept everyone who applies. So this is definitely a collaboration in helping everyone be successful. Now here's a PowerPoint. If you want to just flip through and kind of review some of this stuff. What I wanted to do was was get to this part where we could look at the different resources that are available. Now this is a PDF, and it's going to be the same thing that we're going to see down here, but I'm going to jump down here to look at it. And it is, when I advise students, I ask them to download this. It's got the directions right here to make a copy. Let me make it bigger so y'all can see it better. So you'll make a copy and then share it with me. You write in your name, your potential major, your interest, and then you start adding in your classes. Make it smaller so I can actually see more. Okay, so, and how does this work? So say you come in and you, maybe I'm gonna go with the less traditional, or, you know, not traditional, but say I need to like work up my math skills a little bit before taking chemistry. I go down, I copy that one, I put it in the square. And then once I take that pre-calculus, maybe my advisor says that I can take chemistry with it, or I can take chemistry after. And I'm gonna go ahead and take it with it. And then maybe I take a humanities class. So other classes aren't on here, so you can just type them in. Notice how it adds up your hours, so it helps you see how many you have. I personally love color coding, so that's why it's color coded. So the reason that I do this with students is that there are certain classes like this cell and molecular biology is only offered in the spring. When you look at this document, you see that I put the prerequisites here. And one of the prerequisite for cell and molecular biology is chemistry 132 and the chemistry lab. Okay, well, that means I need to take the chemistry lab here too. Okay, well, how many hours is that? That's 8. So I could add 1 or 2 more classes. Oh, I didn't put humanities in. All right, so now I'm at 12. So I could potentially add another class. 12 is full-time. A lot of, in order to graduate in 4 years, they encourage you to take 15 to 16 a semester. So students, I use this with students to help populate, because one of the things to keep in mind is that, so here's first year, second year, third year, fourth year, and this person is planning to graduate in 4 years. Okay, so how do you get in all your courses that you want to take within 4 years? Some people do this in their head. I like to see it. Also, and there's another row down here because some people don't graduate in 4 years. But the thing I want to point out to keep in mind for the big picture is that if you wanted to start your graduate school experience here right after you graduated, so I want to start vet school right here. And right after I graduate, that means I need to apply to veterinary school a year before. In order to have a complete application, I need to take the graduate admission test for vet school. That's for vet school, it's the MCAT. For medical school, it's the MCAT. For pharmacy, it's the PCAT. For dental school, it's the DAT or the DAT, which doesn't sound as good when you just say it, so everyone says DAT. So that's why I just put graduate admission tests. If some schools, some programs like PA programs want you to take the GRE, so that would be your graduate admission test. So you want to take that and you want to take it either in the spring or early summer, so you have a complete application, and you want to turn in your application as early as possible, as close to the opening of the application as you can. So say I'm going to take the MCAT. I need to make sure, if I'm going to take the MCAT, I'm going to put MCAT, let's say May 21st. No idea what that date is, but sounds good. Okay, so I'm taking the MCAT right here. That means in order for me to be prepared for it, I need to study a lot, and I need to have taken all the classes that I plan to take to help me prepare. Don't want to scare you of the test, but I want to scare you a little bit. It's a lot. It's a lot of information. And this list of classes that are here are the classes that we recommend for you to be successful. Let me finish this thought and then I'll get your question. So I want to back plan and make sure I've got all my classes in. So that's why I create this table with students. I told y'all about the PDF, but I want to use it here. If you go to the bottom, the second tab down here, it's got this information of, if you're pre-med, these are the courses that are either recommended or required. If you're pre-farm, courses that are recommended or required, so on and so forth. Now, sometimes it depends on the school. So if you're interested in being a physician's assistant, notice how it says plus or minus required. It depends on the school. And so that's when you want to start making a list of schools, and maybe use this as a template if you like, and start marking off the classes that they require. Pretty much all of them require chemistry. Pretty much all of them require anatomy and physiology, and that may be AMP1 and AMP2. But do they require microbiology? Well, how do I put required? I guess enough of them do. Do they require biochemistry? Plus or minus, I don't know. It depends on the school. So this can give you guidelines as to the courses you should expect to take. Now, each school makes their own decision. There's not a governing body that says all medical students in the country must take this class, but it's more of a standard with the medical, medical, farm, dental, and vet. Physician's assistants, PTs, OTs, dietitians, so on and so forth, depends on the school. You had a question. I answered it. Okay, I wondered if it was about this table. How do you know which classes to take, right? So basically, let me go back over here. So I took all these classes and I color coded them, and I put them right here for fun. So basically, you're gonna, for the I feel like a basketball thing. For the big four, you're going to want a lot of chemistry. One thing I will point out is that for pharmacy, they expect you to have a chemistry-based biochemistry. And then there's some other little nuances, like medical students or pre-med students who have taken the MCAT and either done well or didn't do as well, took it again. They say, and I've had students that have taken both the biochemistry in the chemistry department and in the biology, and they say that the chemistry base is better preparation for the MCAT. So there's little nuances like that, but basically the courses that you take are generally listed here. You don't need all the biologies. There are some that are higher yield or better than others, like biology. Cellular biology is a great one to prepare you for medical school. Mammalian physiology is a great one to prepare you for medical school and for the MCAT. The other ones, they're great. They're good. They're really good. But those would be like the two most important. Now, what if you want to take anatomy and physiology and health wellness promotion? Or what if you are a health wellness promotion major and you took it there, or you took it at a community college and you're transferring in and they gave you credit for these? That's okay too. You want the information. If you get to choose at this point and it doesn't matter which one you take, I would recommend taking these classes in the biology department because they're 300 level. There's going to be more information there. It's going to be a little more challenging. It's going to be based more on the cell and how the cell functions, and that's what medicine is about. medicine, you want that your level of knowledge for going into the big four and PA is going to require you to understand physiology from that like cellular biology kind of perspective. But this can be a good foundation. I would just default this one. For physics, you'll notice there's two versions here. This is the trigonometry and geometry-based physics, or introductory physics. These bottom two are calc-based physics. You can take either one. It doesn't matter. The thing about the calc-based is you have calculus classes you have to take along with it. Now, if you're a chemistry major, you're going to have to take physics, calc-based physics 1. If you're a chemistry BA, you can take either one of these. If you're a chemistry BS, you have to take this one. So, there's little nuances like that where you are basically kind of double dipping. You're taking a class for your major, and it's also one of the MCAT courses. Last couple of things, in this Fundamentals of Neurosciences is a really good class to help with some foundational knowledge. The nerve cell is a unique cell in the body. It's the only cell, the nervous system cells are the only cells that can carry an action potential or electricity across them. So having a deeper understanding of that is a great foundation. The MCAT and the somewhat of the DAT and the PCAT, they test on intro to psych and intro to sociology. And so we recommend those. And then the last I'll say is if you're interested, if you're in state and you want to go to Chapel Hill requires statistics. Not all schools require statistics. Some schools just require you to have a math. It doesn't matter. So you are not required to take any or all of these. It just really depends on the schools that you're interested in. So for me, this is a new requirement, but for me, I was in state. I was looking at Chapel Hill in East Carolina because of in-state tuition is much nicer than paying full price for the education. Okay, so going back to this page, so where did all that stuff come from? It's right here. This is the PDF of that information, but I should probably just take it off because it's a little, there's one place. Let me pause for a second and see if there are any questions. You're welcome to put them in the chat too if y'all have a question. Yeah. No, the question was, do I mean transferring to Chapel Hill? No, I wanted to go to Chapel Hill for med school. So for majority of health professions, so for medical, dental, and PA school, you need an undergrad degree. And it doesn't matter what the degree's in. If you love art history, do it, because that passion and your interest in it, you're gonna fold in the other science courses. You have to take those as well. But that'll make you stand out because you are, you talk about your passion. We interviewed a guy today who was on an admissions committee, and he said one of the most important things when he does an interview with a student is, do they have a spark? Do they have a passion and desire to practice medicine, but also, that spark comes out in other things. There are some programs for pharmacy and for veterinary school that you can go in, you can get in before you graduated from undergrad, but those are not as common. And like, we have a branch of the Eshelman School of Pharmacy that is here in Asheville. And I'm not sure that they've ever accepted someone who had not yet graduated from college. I think everyone's graduated. So it makes you more competitive. You've completed something. Your level of knowledge, your maturity level is higher. So just because they might accept someone without a degree. That's usually a pretty special somebody. Most of us have to get the degrees. Now, UNC Asheville does not have graduate degrees. We do have we have been working with Chapel Hill and NAHAT, so that it, just like the arm of Chapel Hill's pharmacy school is here, we have an arm of their MPH program that's here. But you apply to the UNC School of Public Health or the UNC School of Pharmacy to get into those. Another page, another thing that's here to look at is this comparative list of PA programs. There are 9 or 11, I can't remember at this moment, PA programs in North Carolina. This document was created by someone at Duke, which I like to say is why Duke is first. Now, Duke was the first PA program. I believe it was medics were coming back from Korea, and they had all this great experience and education with trauma, but they couldn't practice medicine in the US. So Duke made a PA program for them specifically. And that's where we got physician's assistants. So this type of chart, I think, is going to be really beneficial, probably for anybody who, whether you're comparing dental schools or medical schools or PA programs. I would probably change some of the information on here, like what is the cost? How length of program? I think that's a really good one. When is the due date? This just says GRE required or not. What is the average GRE of people who get in? That would be a really good question. Maybe what is the average GPA? Says minimum, but like what is, but what is the average? Here, Chapel Hill has a minimum GPA for your prerequisite courses. What are those prerequisite courses? So anatomy, they all want anatomy. They all want physiology, micro. I think micro is down here for this one. But making this kind of chart so that you can see which classes do I want to put on my list and add to my multi-semester plan at UNC Asheville. I will throw in one more thing about PA programs. PA programs are going to train you to do, I've heard 80% of what a doctor does, but it's in a lot less time. So medical school is 4 years. PA programs are generally 2 years. Now, sometimes that might be actually 27 months. They might add in the summer months, but it is a lot of information really fast. So they want you to come in with a large foundation of knowledge already. That's why they require 1,000 patient contact hours. It's also because unfortunately, you have to think about who else is applying and why they can make this kind of rule. There's a lot of nurses and EMTs or medics in the military who have had a lot of medical experience, and they want to be licensed. They want to do more. Maybe the person is an EMT paramedic, and they want to start practicing as more of a healthcare provider instead of a first responder. This is their quickest route to go, and so they may come in with 2,000 patient contact hours. So it doesn't mean you have to become a paramedic. It just means that you need to start thinking about ways to get patient contact hours. The easiest thing right now to do is sign up for things like volunteering with the vaccination clinics. There are clinics on campus. They're happening up at the Reuters Center. And how long those will be going on? They'll be going on until the summer, for sure. Will they be going on in the fall? Maybe for incoming students, but that is a good way for you to quickly get engaged. Now, this document has all the North Carolina schools listed, and it's 2 pages because there's Yeah, there's 11 schools. Now, the reason that this is here is that I found it on Duke's webpage, and I had a student who was pre-med and she was working really hard. She also worked in the hospital. She was a CNA, and she just was getting burnt out. And she was like, I don't think I can do this med thing. I'm just so tired. I'm so exhausted. And I said, well, what about physician's assistant? And she was like, oh yeah, maybe I should do that. And I was like, why don't you start comparing the schools? And so I gave her this, and she started looking. She went to the websites. She started typing this stuff in and looking it up. And she got through almost four different schools. And then she said, you know what? I'm less tired. I got something to eat. It's been a couple days. I feel less stressed out. I want to be a doctor. And so she quit. So I posted what I had. All right. So I'm actually talking to someone who is at Wingate, and he has made a chart like this. So this may get updated soon. And that's actually a good lead in to so again, that was here. Okay, so I want to show you the events and opportunities. And I kind of use this as my catch-all for all the good stuff that's going on. And because I just talked about the PA from Wingate. So right now we have a pre-PA information session scheduled for here. This looks like it might move because this PA student at Wingate, who actually is he was at UNC Asheville for his prerequisite courses, is interested in coming, but this time of day probably doesn't work for him. So I highly, if you're interested in PA school at all, definitely come to that. So we have multiple events, and I always update when I have new events. I put them on this page, and then I also send it out via the email list. If you haven't joined the email list, please join it. Some students get my emails through the office assistant in their department, but sometimes I don't want to bug that office assistant because I already sent something out, maybe a couple of days ago, or like I sent one out yesterday and the second one today, and I bugged them anyway. But sometimes I don't want to do that, and so I'd rather just email the students. Or if you are really interested in dentistry and I find out about a special event, such as Alice Jameson coming on Thursday, I want to specifically email that to you. So again, I encourage you to join the email list. All right, last couple of things I'll just put for highlights. There is an aspiring healthcare professional student group. The student group, the whole mission is to help students get to know their professors and work to volunteer and do things and learn more about how to get into these healthcare programs and help other students learn about it. So they're, for example, with a heart dissection, which they're going to repeat, they bring the guest speakers, such as the dental student, the dentist who's coming in. But they also meet every Thursday at 5 o'clock. It's an open meeting. I didn't put the link here because I want you to sign up and I don't want any other weird people to join. So, but this Thursday, because the education they're going to get from this dental student who is also, she's currently in the MPH program, this was the only time that she could do it. So they're canceling their meetings so that, hoping that everyone will come to this. But it's an open meeting planning. You can get to know other students who are interested in this stuff and see what they're working on. We have multiple advising groups or advising events. This is the last of the overview. There may be another one later in the semester. The discipline specific are like the dental thing and the PA thing I told you about. And then the small group pre-health advising, that's the way I am doing advising this year. So I'm asking students to start to create that multi-semester plan and then sign up for one of the advising events, which is here. on the Sign Up Genius. And lastly, what are some of the opportunities we have here? So applying to medical school, getting into medical school, all that is applying to dental school, applying to PA school. There's a lot to do. It can feel really overwhelming, but remember, you have multiple semesters to do it. And so my biggest advice to students, especially when they start feeling stressed out about the big picture, which is going to happen, it happened to me, is to stop and say, what can I do today? What can I do right now? Well, right now I have an organic exam tomorrow. I'm going to study for organic. But then, take your exam and think, well, I don't have any more exams or homework for the rest of the week. Maybe I can sign up for one of the vaccine clinics. Oh, those are full. Well, maybe I can reach out to the Key Center. Key Center is a part of the university that connects with community. They help students get internships or volunteer experiences. They are in charge of the blood drives that are coming. So all of these, that it's a great resource. Their goal is to help you get connected. Another great experience to help build your knowledge base and your resume or your application is the undergraduate research program. And I'm just going to let y'all read that later, just so I can kind of go through more quickly. We have a summer internship at MAHAC where students actually get to shadow a doctor. They do didactics and they also work on a community engaged project. It's part-time for 2 weeks over the summer. For 10 students, and it's paid. It's a pretty unique, pretty incredibly special opportunity. Applications have closed for this semester, but starting to get to know it and see how, what that's about would be a good idea. This is primarily, well, it's for students who want to go into clinical. So if you're interested in public health, that's great, but they prioritize clinically oriented, clinically gold students the most. The NPH program, this is kind of dated now because this is frequently asked questions, especially about COVID and your grades and stuff based on that. I do individual pre-health advising meetings, but right now I'm trying to get students to go into the other ones that are above. And then the Writing Center and the Career Center. Writing Center is going to help you with things like essays for application. Career Center is going to help you with your resume. If you want to apply to the MAHAC summer internship, you're going to need a resume. They can help you, and you're going to need a personal statement and a cover letter. The Writing Center and the Career Center can help you. The Career Center can help you with the cover letter. The Writing Center can help you with your personal statement. Last couple of things I want to point out are these other resources here. And these are some of the best resources that I have found to help students in general. If you're interested in healthcare, but you don't know exactly what can you do today? What can you do tomorrow after your chemistry test or whatever? Go here and start looking at the different careers in allied health. Maybe you're like, I really love genetics. I think genetics is really cool. What is a genetics counselor? Now know that this is, I wouldn't set all this in stone. Depends on where you live, and who you work for as to how much you get paid. But this will tell you an overview of the job, the working conditions, the academic requirements, and then you can actually go to these websites where you can find more specific information. This website has a lot of stuff here, like there's the allopathic, the MD, the osteopathic, the DO, or the physician's assistant. What about mental health? Psychiatrist, psychometrist, which I don't actually know what that is. But this is a great resource for learning more about different ways of engaging. This is another really good one. This one is a little more like just straight to the links for the schools that are to the professional organizations affiliated with it. Sometimes students need to take a gap year, which means like maybe going back to this page here, maybe the student decides that junior year, they're not quite ready for the impact. So they're actually going to move this and apply, I mean, take the MCAT there. So that means they're going to apply to graduate school here. And then they would hopefully start graduate school here. So that means they have a gap year. So what are some options for a gap year? Or maybe they apply one time and they don't get in, so they need to reapply. So this is just information that this organization, the National Association of Advisors for Health Professionals, it's a group of people who all have jobs like mine, or this is like I teach as well. A lot of them don't teach, they're just advisors, and this is what they do, and they share the information. And so that can help you as well. And then and some of the options for like reapplying or ways to build your application is to do a post-bac program or a master's of science. All right, so that's a lot of information. If I was new to this and wondering, okay, wait, so where do I start? Go back to the student courseware and resources and start creating your student template. And then also, here's another link. I really want to, can you tell I really want you to go to the events and opportunities page? I like put the link everywhere. Join the email list and then go to as many of these events as you can. And this is the only one that I scheduled in person for right now because of COVID, to see if students were more interested in it. These are going to be remote. Maybe you're like, oh, people's mouths are gross. I definitely don't want to be a dentist, but maybe the MPH is going to be really interesting to you. The benefit here of coming to this, even if you don't want to do dentistry, is learning from someone who went through the application process. She had to decide, she had to get experience so that she could demonstrate on her application and in her interview that she knew what dentistry was about and that she wanted to do it. She had to probably do volunteer experience. She went through interviews. So you can find little nuggets of gold, as far as information for how to be successful. And then Kristen Willingham, she is a graduate of UNC Asheville, and she is in medical school now at Chapel Hill. So again, she's going to talk about her experience. So trying to come to as many of these as possible. Yeah, okay, so I am going to stop there and see if there are any questions that come up. I'll leave it recording just for a second to see. All right, I'm going to go ahead and stop recording if I can find